Welcome, everyone. It's a great pleasure to welcome here Professor Sonia Frota from the University of Lisbon. I'm talking on behalf of the Speech Prosody Special Interest Group from ISCA, and we are honored and very happy to have Sonia Frota with us. Sonia Frota is full professor of the Department of Linguistics, School Arts and Humanities of the University of Lisbon. She is scientific coordinator of the Center of Linguistics of the University of Lisbon. She is director of the Lisbon Baby Lab. We will be knowing several things about this lab today. She is executive director of the Mind Brain College. She is editor-in-chief of Journal of Portuguese Linguistics and associate editor of Phonetica. She is vice president of the International Phonetic Association and was chair of the Speech Prosody Conference realized in 2022 in Lisbon. Her research focuses on early speech perception and language development and on prosody in language. Her research is strongly rooted in multidisciplinary collaborations and in partnerships with health, education, and parent institutions. Please, Sonia, the floor is with you.
Thank you very much, Plinio. Let me just share my screen. Okay, so I would like to start by thanking you. And thank you, the Special Interest Group and the Speech Prosody series organizers, for the invitation to be here. It's a great pleasure to be here and to share with you some of the research that we have been doing at the Lisbon Baby Lab of the Center of Linguistics of the University of Lisbon during the past 10 years. So let's start then. Okay, so I'll be talking about early perception of prosody in atypical language development. And I have to start by saying that there is by now a vast literature on infants' early sensitivity to the prosodic properties of speech, which possibly relies in a universal biological mechanism rooted in general properties of the mammalian auditory system. This early sensitivity is unsurprising, as prosody is the first experience that we have with language. This early sensitivity is also the foundation for prosodic bootstrapping, as prosodic properties, such as stress and intonation, may help with learning many different aspects of language. This early sensitivity is generally thought to be independent of the native language. However, early development of prosody is also shaped by the ambient language, and this has been underscored in recent research. We know that although the functions of prosody are quite general across languages, prosodic cues are language specific. For example, let's take word stress. In some languages, pitch may be the main correlate for stress. In other language, it may be duration. In another different language, it may be something else, or the different cues may be weighed differently. If we take questions as another example, in some languages, questions may be signaled by rising pitch, in other languages by low pitch, in still a different language by peak alignment, or by peak height, or by duration, just to give you a few examples. So, crucially, languages vary as to which prosodic cues are relevant and informative to cue a given language category or convey a given meaning. This raises a fundamental question. If early prosodic perception is guided by the native language, then which prosodic properties are attended to in a given language and have thus the potential of scaffolding language learning. An added challenge concerns the comparison between typically developing and atypically developing infants that have varied language experiences. Atypically developing infants differ in many respects from typically developing infants. And it is largely unknown whether and how early prosodic development differs in atypically developing infants, starting with the early perception of prosody. In this talk, I address these questions by examining early perception of prosody in two groups of atypically developing infants: European Portuguese learning infants at risk for language impairments and European Portuguese learning infants with Down syndrome, on the basis of a series of speech perception experiments using eye gaze paradigms and focusing on stress and intonation. So, children at risk for language impairments, I will be talking about this group as the at-risk group or the AR group, include children with familiar risk for neurodevelopmental disorders like autism spectrum disorders or language disorder, or children that are preterm or that have low birth weight. And prior work suggests that these children at risk for language impairments, they display poor language abilities in language perception and production, including delayed or atypical processing of prosody. Despite a few studies that have examined perception of prosody in at-risk infants, it remains unclear whether prosody and specific aspects of prosody like stress and intonation are initial strengths or weaknesses due to conflicting findings and lack of studies focusing on early development. Such information would be key to inform early language interventions to support language development. Children with Down syndrome have a genetic perturbation known as trisomy 21 that is the most common genetic cause of intellectual disability affecting language development and language processing, with language comprehension and production deficits in various domains such as phonology, vocabulary, or syntax. There are only a few studies that have examined early language abilities in infants with Down syndrome, and it is thus largely unknown what their initial strengths and weaknesses are. Again, such information would be key to inform early language interventions to support their language development. Okay, let me just give you an overview of the talk. I will first guide you through the early perception of stress experiments that we have conducted and present the findings for infants at risk and infants with Down syndrome and compare them with findings for typically developing infants. Then in the second part, I will guide you through our studies on early perception of intonation in infants at risk and in infants with Down syndrome, and again compare them with the results for typically developing infants. And finally, I will conclude with a discussion of all the findings. Okay, so let's start with stress. We know that word stress is a prosodic dimension that varies across languages in two crucial domains. So one is phonological grammar. We have languages that show variable stress, such as English or Portuguese, languages with fixed stress, like Finnish, language with no stress, no word stress, like French. Language also vary with respect to the phonetics of stress, as we know, because we can have different correlates of stress across languages, different weighting of the possible cues, speech, intensity, duration, vowel quality, etc. Importantly, word stress seems to be a powerful bootstrapping tool, as infants may utilize stress to facilitate the segmentation of the speech signal or to help with the categorization of words into broad word categories, such as, for example, lexical words and function words. And this in turn facilitates word learning, vocabulary development, and also syntactic processing. Indeed, atypical early perception of stress has been suggested to be linked to delays and or difficulties in language acquisition. Let me now briefly characterize 3 aspects of word stress in European Portuguese. European Portuguese is a language with variable stress. Stress may be located in the final syllable, the penultimate syllable, or the antepenultimate syllable of the word. And stress is lexical distinctive because we can have words that have different meanings only because stress is in a different location in the word. The frequency distribution of stress patterns in European Portuguese shows conflicting cues. If we consider lexical words and their type frequency, the trochaic pattern predominates. However, if we consider token frequency in connected speech, the iambic pattern predominates. With respect to the phonetics of stress, earlier findings have shown that there are basically 2 main cues for stress in the language, and these cues are vowel quality and the duration of the stress syllable. Moreover, studies on stress processing in adult speakers have reported behavioral findings that indicate a stress deafness effect, or in other words, no discrimination of stress in the absence of vowel quality cues, whereas ERP findings indicate successful discrimination of stress even in the absence of vowel quality cues. There is a common result in both types of findings, behavioral and ERP findings, and that is a processing advantage for iambic stress. A previous study on typically developing European Portuguese learning infants' ability to distinguish trochaic and iambic stress patterns on the basis of prosodic cues alone found that there is an asymmetrical perception with a preference for the iambic stress pattern in 5 to 6 month olds in the presence of segmental variability, showing that stress discrimination in a language with conflicting cues to stress, such as European Portuguese, develops differently from in a language that is stress-based, such as English or German, or in a language that is syllable-based, such as Spanish or Catalan, or differently from languages with clearly distinct frequency distributions of stress patterns, even in the presence of segmental variability. The processing advantage for the iambic stress pattern in infants was confirmed recently in an EEG study with typically developing 5 to 7 month olds. Okay, so these are the findings for typically developing infants. But what about infants with Down syndrome and infants at risk for language impairments? We examine early perception of stress in these 2 groups of atypically developing infants to determine whether they are also sensitive to stress distinctions, and to know whether stress processing may be seen as an initial strength or an initial weakness in these two groups. If strong discrimination abilities for stress are found, then stress might be used in early intervention as a tool to boost language learning, exploring the various language aspects that stress might help to learn. If infants with Down syndrome and/or at-risk infants show poor discrimination abilities for stress, then they will be less able to exploit stress cues to learn the language, and stress should be seen as a domain of difficulties to be targeted in early intervention. In our studies with atypically developing infants, we use the same materials and procedure as in our previous study with typically developing infants. The materials were disyllabic, segmentally varied pseudo-words with stress in initial position, so trochaic pattern, and final position, iambic pattern. These pseudo-words were uttered by a female speaker in infant-directed speech. And let me play you some examples. Okay. Here, there are only prosodic cues to stress. So these are the only cues to stress, namely the longer duration of the stress syllable and the location of the pitch fall. We use an adaptation of the anticipatory eye movement paradigm, utilizing eye tracking. And I will present you with a small clip of a section of an experimental block of the experiment. So this is the training phase. Now the test phase. And the reward. Okay, so in this paradigm, discrimination would be signaled by longer looking time to the trained side. So the side trained in the training phase. And we might also get discrimination with a preference if we get an asymmetry in looking time with longer looking time to just one of the trained sides, regardless of the stimuli heard in the test phase. Our participants were 13 infants at risk for language impairment. The age range is between 5 and 7 months, and 25 infants with Down syndrome. The age range is between 5 and 13 months. The infants with Down syndrome were full-term, had normal hearing to mild hearing loss, and normal or corrected to normal vision, with no other relevant medical conditions. So, the results. Starting with the at-risk infants, we found no differences in looking time to the iambic and trochaic sides. So, no evidence for a distinction between the iambic and trochaic patterns. Therefore, no stress discrimination or stress preference, unlike for typically developing infants. Now, the results for the infants with Down syndrome. We again found no difference in looking time to the iambic and trochaic side. So no evidence for a distinction between the iambic and trochaic patterns. But given the broad age range of infants with Down syndrome, we divided the sample into two age groups, before and after 7 months of age. And we found an interaction between side and age group, with younger infants with Down syndrome approaching the typically developing pattern. But it's just a trend because when we look at younger infants with Down syndrome per se, we see that the difference between iambic and trochaic does not approach significance. Now, looking at all the groups together, including the typically developing infants, we get a group effect with at-risk infants showing longer looking times overall. But both the at-risk and the S groups, and although younger infants with Down syndrome were found to approach the typically developing pattern, for these two groups, there is no evidence for stress discrimination, which raises questions about the potential role of stress as a bootstrapping tool in these atypical groups. Right, so we have seen the findings for early perception of stress. We will now look at the findings of the studies on early perception of intonation. Unlike stress, intonation, unlike stress that is a word level property, of course, intonation is the domain of prosody that refers to the use of pitch to convey phrase and sentence level meanings, such as the distinction between sentence types, like the difference, for example, between statements and questions. Intonation and related pitch cues have been shown to play a role in language learning. Typically developed infants display an early sensitivity to pitch, and TD infants and toddlers have been shown to exploit the intonation cues available in speech to learn about many different properties of their native language. For example, pitch cues have been shown to help with word segmentation, and also, of course, they've been shown to be crucial to identify phrase boundaries. This in turn helps, for example, with the identification of syntactic structures. Like in the case of stress, atypical early perception of intonation might be linked to delays and/or difficulties in language acquisition. In this talk, I focus on the distinction between statements and questions, which is crucial for communication and social interaction. In European Portuguese, there is a fairly robust intonational marking of sentence type distinctions. And the distinction between statements and yes-no questions is conveyed solely by prosodic means, unlike in languages such as English or German. Statements show falling pitch, and this is due to the nuclear contour. So we have a final high-low stop pitch accent, followed by the low boundary tone, whereas questions show falling rising pitch, and the difference is due to the presence of a rising boundary tone in yes-no questions. This contrast is perceived by adult speakers. A previous study on typically developing EP-learning infants' ability to distinguish the intonation patterns of statements and yes-no questions in European Portuguese found that they are able to discriminate utterances that differ only in the prosodic features that cue statements and questions as early as by 5-6 months of age. In several collaborative work, since we conducted this first study, we have been looking into whether infants are just responding to the phonetic salience of the pitch contrast, or whether they are listening natively, meaning that this ability would be dependent on language experience. We have shown that German learning and English learning infants do not show a similar development of this discrimination ability. Specifically, German learning and English learning infants were unable to discriminate intonation contrast by 4 to 6 months of age. This suggests that the early discrimination ability requires experience with a language with a robust and tight correspondence between intonational marking and sentence type meaning. So, we have this set of findings for typically developing infants, and of course now we want to know how does intonation perception develop in infants at risk for language impairment and in infants with Down syndrome. To that end, we examined early perception of intonation in these two atypically developing groups of infants to determine whether they are also sensitive to pitch cues like typically developing infants, and to know whether intonation processing might be seen as an initial strength or an initial weakness in these two groups. If strong discrimination abilities for intonation are found, then intonation might be used in early intervention as a tool to boost language learning, exploring the many language categories and functions conveyed by intonation. If, by contrast, infants with Down syndrome or at-risk infants show poor discrimination abilities for intonation, then they will be less able to exploit pitch cues to learn the language, and intonation should be included as a domain of difficulties to be targeted in early intervention. For the experiments with atypically developing infants, we used the exact same materials and procedure as in our previous study with typically developing infants. The materials were segmentally varied single pseudo-word bisyllabic utterances with initial stress produced by a female speaker in infant-directed speech with either statement or question intonation. I will play a few examples for you. Right, so as you could listen, the critical cue for the distinction is the final pitch difference in pitch height and direction. And indeed, we have a difference of over 200 hertz in pitch height between the statements and the questions. We used a modified version of the visual habituation paradigm. Infants were habituated with lists of stimuli for a given pitch pattern. Half of the infants were habituated to statement and half to question. We used different pseudo words for the habituation trials and the test trials in both types of patterns. And there were two test trials. So one same trial. This one shows the same pattern as habituation, and one switch trial with a different pattern from the habituation. The order of presentation of test trials was counterbalanced. In this paradigm, discrimination is demonstrated by longer listening times to switch test trials compared with same test trials. I have here a short clip of the experiment. The sound is rather low, so I will try to make it louder. Let's see if you can listen to it. Okay, so first we had an example of an habituation trial, immediately followed by the two test trials. As you could see, it is a very boring task, but infants love it. So 36 infants were included in the study with at-risk infants. There with an age range between 5 to 10 months. And 21 infants were included in the study with infants with Down syndrome, with an age range from 5 and 13 months. And the inclusion criteria were the same as in the stress studies. So let's now jump into the results. First, for the infants at risk for language impairments. We can see that infants looked longer to the switch trials. So, like typically developing infants, at-risk infants are looking longer to the switch trials, which indicates successful discrimination of the intonation contrast. Now, the results for the infants with Down syndrome, again, we see that overall, infants with Down syndrome, like typically developing infants and also like at-risk infants, looked longer at the switch trials, indicating successful discrimination of the intonation contrast. So these results differ from those found for the perception of stress in these two atypical groups. Now, when we examine the findings for all the groups, including the typically developing infants, we find a big effect of trial type with longer looking times for the switch trials, and also an effect of group, as the at-risk group shows shorter looking times overall. Further inspection confirmed that the difference between same and switch was significant within each of the groups, thus confirming successful discrimination for all the groups. So for the at-risk infants, for the infants with Down syndrome, like the previous findings for typically developing infants. And this seems to be a nice finding with respect to the possible use of intonation as a bootstrapping tool, also in these atypically developing groups. In the typically developing study, infants were divided into an younger group below 7 months of age and an older age group above 7 months of age, as we were interested in the developmental path of their perception abilities for intonation. Thus, we explored potential age effects also in the two atypically developing infants, dividing the at-risk and Down syndrome groups in a similar way. Crucially, we found that differently from typically developing infants, older infants in the at-risk and Down syndrome groups were unable to discriminate the intonation contrast. This is a result that might have implications for the role of intonation as a potential bootstrapping tool. Okay, so now we get to the final part of the talk. What have we learned? Unlike for typically developing infants, we found no evidence for an early ability to discriminate stress patterns in both infants at risk for language impairment and infants with Down syndrome in the challenging context of phonetic variability, and this was the context under study. There was a trend for younger infants with Down syndrome to be more sensitive to the stress contrast, suggesting a decrease in sensitivity with age, but this was not significant. We had asked whether atypically developing infants were also sensitive to stress distinctions like typically developing infants. On the basis of our findings, the answer is no, they are not. We also asked whether stress processing could be seen as an initial strength or weakness in these two atypical groups. It appears to be an initial weakness, despite the suggestion that in the case of younger infants with Down syndrome, there is some sensitivity to the stress contrast. The poor early abilities for stress indicate that atypically developing infants are less able to exploit stress cues to learn the language. For example, to use stress to facilitate word segmentation or to establish broad word categories, skills that are related to word learning and the development of syntax. This strongly suggests that stress is a domain of difficulties to be targeted in early intervention, and that stress training should be included in early language and communication interventions for infants at risk and infants with Down syndrome to support their language development. Now, differently from stress, atypically developing infants, like typically developing infants, exhibited an early ability to discriminate the sentence type contrast in the challenging context of phonetic variability. However, unlike their typically developing peers, this early sensitivity to intonation appears to decrease in older infants who fail to discriminate the intonation contrast. We had asked whether atypically developing infants were also sensitive to pitch cues, like typically developing infants, and our findings indicate that yes, they are, but within a sensitive time window. We had also asked whether intonation processing was an initial strength or weakness in these groups, and our answer on the basis of our findings is that intonation processing is an initial strength, but limited to the very early stages of development. These initial strong discrimination abilities for intonation highlight a crucial developmental window when intonation might be used in early interventions to support language learning. Infants at risk for language impairment and infants with Down syndrome might thus be able to exploit the pitch cues to learn the language. For example, typically developing infants have been shown to use pitch cues to facilitate early word segmentation from 4 months of age. This strongly suggests that intonation, which has not been included in early interventions, should be added as a tool in language and communication interventions from birth in these atypically developing groups, emphasizing the many language categories and functions that might be cued by pitch. The poor discrimination abilities for intonation after 7 months of age indicate that older atypically developing infants are less able to exploit pitch cues to learn the language. For example, they might be less able to use pitch to facilitate word segmentation or to learn the different sentence types. So in this case, intonation is a domain of difficulties to be targeted in early intervention, and intonation training for older infants should be included in language and communication interventions for this group, so for older infants and toddlers, to support their language development. What may we conclude then? We may thus conclude that prosody plays an important role in atypical language acquisition, but with distinct developmental paths for different prosodic properties. Intonation perception, unlike stress perception, is highlighted as an initial strength, and there appears to be a sensitive time window for exploring strong pitch discrimination abilities to boost language learning. And this, of course, has implications for early intervention strategies that are age-tailored to better support language and communication outcomes in atypical language acquisition. And I would like to end by thanking you for watching. And I would like to acknowledge and thank all my colleagues and collaborators, the research assistant, the students. So without them, this research would not have been possible. And last but not least, I thank all the participants, all the babies, their families, as well as our collaborators from the health and clinical institutions that have contributed to these studies. Thank you very much.
Thank you so much, Sonia. Now it's time for questions. We'll be waiting my student Gustavo Silveira to bring the questions to the chat in order to Sonia to reply to them. Meanwhile, Sonia, I have two short questions, if you want to talk about them. The first one concerns if, in other experiments, if you have found any difference between the two atypical groups, because in this presentation we only showed that they seems to behave similarly as regards word stress and intonation. And the second question is, what about the prosodic function of sedimentation? We know that duration is very important for marking a boundary. And do you think it would be possible to explore duration in this function of lengthening to mark a boundary in a short utterance for an infant to be able to perceive? What do you think about that?
Okay, yes, thank you, Plinio. So with respect to the first question, you are right. So the two atypical groups seem to go together, right? So no early abilities for stress and early abilities for intonation. But in fact, for stress, we had, it was a very small effect, but we had an effect in the younger infants with Down syndrome. So the younger infants with Down syndrome, they behaved like closer, let's say, to the typically developing infants, whereas the older infants with Down syndrome show a deviation, so they deviate from that pattern. This behavior is different between the younger infants with Down syndrome and the infants at risk for language impairment, which seems to suggest that infants with Down syndrome have more sensitivity to these prosodic properties than the infants at risk for language impairment. But of course, when we talk about infants with Down syndrome, although there is also a lot of variation, right, among infants with Down syndrome, but still there are a number of features that are very coherent in this group, and that characterize this group. Whereas when we talk about infants at risk for language impairment, so the variation is huge, because we are here considering together, we are considering the infants with familial risk, so that have a close relative or a sibling that has been diagnosed with neurodevelopmental disorder that affects language, for example, and also the preterm infants. And of course, I imagine that the following question would be whether there is a difference between these two subgroups of atypically developing infants, so the ones at risk for language impairment. So here it becomes tricky, because the sample size gets smaller. But as far as we can tell, at least at the present moment of the research, they seem to behave similarly. And in fact, we put them together because our first idea was to try to find something that characterizes these infants at risk for language impairment. Because if we find something that is general for infants at risk for language impairment, this would be quite useful for the clinicians. So yeah.
You can reply to me to my second question later on, because we already have 3 questions.
Okay.
Gustavo?
Fine. So I have them. I have them in the chat. Yes. Okay. So let me see. Okay, Martin. Hi, Martin.
Sorry, Sonia, I think it's a good idea, if you're going to read the question, to read it aloud, so that the audience know which question you are.
Okay, I will read the question. Okay, no problem. Okay. So I was saying, hi, Martin. Martin Grice asked the following. Could it be that older infants in the atypical group are confused by conflicting cues in questions where stress syllables are low, whereas high pitch might be a better cue to stress? Okay, so yes. The thing is, in European Portuguese, high pitch is not considered to be a reliable cue to stress. And the reason for this has to be with the very low covariation between having a pitch accent in a stress syllable. So the low covariation between pitch accent and stress syllable. Because we have a sparse distribution of pitch accents in the language, and this means that we have many more stress syllables without pitch accents than we have stress syllables with pitch accents. Okay, so this is why in the literature in general, duration is regarded as a robust, much more robust cue to stress than pitch in the language. But then, okay, so this is what we have in the language. So the cues that the language is offering, right? The input is offering to infants. So on the basis of these cues, I would say, no, I don't see a reason why older infants would want to match high pitch with word stress, exactly because the language is not offering this. In fact, the language is saying something else. But I imagine that in a language like English or German, this would make a lot of sense. And this also raises the question of to what extent these results are modulated by language experience, right? So it would be really great to conduct these studies in other languages with different properties, right? So different properties, different cues for stress, and also languages that, as we did a little bit of this for the intonation contrast. So we haven't done that for stress. So I don't know if that answers, but if not, please just ask another question. Okay, and I'll try to follow on that. Okay, so now we have another question by Marta. Hi, Marta Ortega. So why do you think that the atypical groups have this time-sensitive window for intonation? Why do they stop using it as a relevant cue? Yeah, so this is really an important question. This was, in fact, a very surprising result that we got. So we are more expecting the reverse, right? We're more expecting that for atypically developing infants, they would need more time. Okay, so they would need more experience with language, and probably they would be sensitive to these prosodic properties later in development than typically developing infants. But in fact, what we got was the reverse, right? So we have the younger group that is sensitive and does the discrimination successfully, and then in the older group we get this decrease in sensitivity. So what seems to be happening, but this is of course just a thought, so what seems to be happening is that we have here something that seems to be quite common, in fact, in atypical development, which is sometimes called as a regression, and that clinicians use as a sign, just like an alert for signaling infants as having problems and difficulties with language. So that's our thought for the moment. So it might be the case that we have this window of opportunity, and after that, if we do nothing, there is this decrease with all the cascading effects that have been described. So the language difficulties that these children have later in development. So of course the big question is whether, if we do something, so if we come up with an intervention using intonation, if we can change this. So if we can keep, for example, their sensitivity at the same level, and keep helping them to learn the language. Okay, so Marta is following up on what I'm saying. She's saying, could it be that they cannot match this form difference to a meaning difference relevant to them? Okay, so you are suggesting that, are you suggesting that the younger ones are not making a match between, are not yet making a match between the form difference and the meaning difference, and the older ones are already trying to do that, and this is why they fail? So if I'm interpreting your question right, that could be, of course, that could be the case. And of course, to know this, we need to run more experiments, okay, to do more research. So we need to try to find a way to test this, so that I can give you a better answer. Okay. Right. So we have another question by Cara Hawthorne. I hope I'm saying your name correctly. I'm wondering about matching of the at-risk and Down syndrome groups with the typically developing group. Do you think you might see a stress preference if you matched on developmental level rather than chronological age? Okay, so yes, we thought about this. So using chronological age, or using, as you are suggesting, developmental level or mental age, or in the, for example, in the preterm infants, using corrected age. But in fact, for stress, it is possible. We haven't done it, so we don't know. But for stress, it is possible that if we test the both atypical groups later, right? Maybe what we find is just that they are delayed in terms when we look at chronological age, but not when we look at these other forms of matching them. But what makes me so we need to do it, of course, to know that. But what makes me believe that at this moment, what makes me believe that will not be the case is the fact that in the infants with Down syndrome, because we had this large age range, we were able to divide them into age groups. And even for stress, we saw that the younger group was behaving in a more similar way to the typically developing group than the older group. So this goes against that hypothesis, I believe.
Okay. I think it's all. It's about 2 p.m. here in Brazil, in Brasilia, Brasilia time, and
time flies.
Yes. I thank you so much again, Sonia Frota, for this opportunity to have you sharing your knowledge and so nice experiments with babies, with so many people. We have a very high rate of visualizations. We have more than 100 people that saw your presentation, watch your presentation. 20, whether we are still with 20 people here with us. Thank you so much, and it was very nice to listen to you. Thank you.
Thank you, Plinio. It's a pleasure. Thank you.
Thank you.
Bye.
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 Ai, opa, Gustavo?